This is a really common question. Can I get away with liposuction alone, which a lot of people would prefer, or do I need a tummy tuck? There's basically three things that I look at to help me determine what you're going to need. First of all, how much excess fat there is. Second, and this is probably the most important factor, what's your skin tone or your skin elasticity like? Do you have tight skin or loose skin? Do you have cellulite? Do you have stretch marks, etc.? And then finally, what's happening with your abdominal muscles? Are they tight together or are they spread apart? You see, the problem with liposuction alone is we make a little incision and then we take that long silver cannula, we put that in there, we suction out your fat. But we're not really doing anything to the skin. We're relying on the skin's own elasticity or skin tone to retract and stick back down nice and smooth. If you don't have good skin tone, the problem is that you're likely going to end up with more dimpling and rippling, which will actually look worse. Okay, so if you're an individual that has excess fat, but the skin is really tight, okay, and great elasticity, and your stomach muscles are tight together, liposuction is probably the way to go. But if you're a person that has excess fat, but you've got loose skin with stretch marks and cellulite, your abdominal muscles are spread apart, you're gonna need a tummy tuck. Now, occasionally I'll see patients that fall between these two categories. And these are individuals who have excess fat, but their skin is only a little loose. I mean, it's not a lot of loose, a little loose. In them, I may employ a technique called ultrasonic liposuction. Ultrasonic liposuction is very similar to standard liposuction, except there's one additional step. We treat the tissues with an ultrasound probe first. The ultrasound probe actually looks like a liposuction cannula, but the tip of it vibrates at a very high frequency, creating energy. Now that energy can be used to break fat down, but I also use it to treat the undersurface of the skin, trying to stimulate it to contract a little bit.